What has just happened and what would happen next?
Right, what would happen next? We'll just take this off a sec. So we'd have an impression there that we'd sort of lever out the patient's mouth, hopefully without too much trouble. That did come out fairly easily. So you don't want to have a sort of knee on your chest sort of situation when you're trying to pull it out.
Which means assuming you've got to get the mixture just right, which is what Kesha was doing, was making sure that the water and alginate was perfect mix.
Yeah. But I mean, the final decision always rests on the dentist. So if she mixes it up and she's happy with it, but I'm not, if there's some, I'll say, not quite happy with that. But your nurse should always be better at mixing alginate than the dentist. Dentist should be able to do it, but the nurse will be, but she's better than I am. So she'll then hand it to me. We do the impression. Sometimes you'll find the dentist will hold the impression quite securely, because the problem is, once it's set, it actually comes out relatively easily. If a patient tries to pull it out too soon and it's not set, there's bits of alginate and bits of impression material everywhere. And then you literally have to sort of go into the bathroom with some floss and toothbrush and picks and just pick it out. And it does get everywhere. So as long as it's set, it'll all come out normally in one piece.
And what is the alginate actually made of?
So there's various things in it, but the general two components that we've got algin, which is a kind of a seaweed extract, and gypsum, which is a stone. So the two are mixed together. And what we want is, when we've done the impression, I want something which is still elastic. So the little bits that we've got there, although they're set, they're quite soft. Now, if we leave an impression out on the side of the counter overnight, all the water evaporates and it goes rock hard, and it's like sort of stone. Now, the problem with that is it also shrinks, so the impression's completely ruined. So what we'll do is, we'll take it out, we'll check that it's all right, check there's no tears in it, check there's no bubbles. We'll rinse it under the tap. We might put it in a sterilising solution, or we might spray it with a sterilising solution, and then we wrap it up in a wet tissue. You don't want the tissue, you want the tissue sort of wet, but you don't want to put it into water and leave it in water, because just as it shrinks, it can also expand. And if that happens again, then the impression's ruined. So you're trying to get that impression as close to your teeth and as accurate as possible, so that if you're making a crown, well, you wouldn't necessarily use that for a crown, but if you were making a denture, it's got to be as accurate as we possibly can to your mouth. Otherwise, the denture doesn't fit, and that's where things rock and move about.
It's very clever.
It is very clever. I still have, actually, from when I was a kid, because I had, of course you have it done throughout your life, don't you? Mm-hmm. I still have the little plaster of Paris kind of version of my mouth
keep
as
those.
a child.
You always want to keep those.
Why?
Well, I mean, if it's got sort of baby teeth in, deciduous teeth, then that's just nice to look at, because you can just see a small impression. But if you've had them done when you've got your adult teeth there, you can literally say, right, well, that's what my teeth look like. Are they wearing? Am I grinding them down? Are they getting shorter? The other thing is, let's say, heaven forbid, you had an accident, and if you chip your front tooth, a dentist wants to build up that front tooth, and we're trying to get it back to how it looked before. Now, your front teeth are slightly longer than your laterals, so the two teeth either side. But if you had an accident and snapped those, and I was just going to build them up with composite, with filling material, I don't know how long your teeth sort of were or are. So unless you've got a photograph that's really close, but if you've got a model of those teeth, you bring that model in, I can do a little impression against that model and then put it back in your mouth and build up your teeth, so they'll be exactly the same shape as they are sort of in your mouth.
Which is an interesting point, because they do say, don't they, that when you do have something happen to your teeth, it completely changes your face, doesn't it?
Absolutely. And of course, in your line of work, because you're talking all the time, if you also play any musical instruments, obviously not guitar, but if you play any woodwind instrument
or piano,
or piano, yeah, but because your
drums,
because your embouchure changes, you would find if like, I had a trumpet player that came to see me that needed 2 or 3 crowns, but it was literally at the end of his career. And he said, can you patch me up for a couple of years, because I don't want my front teeth, because the way his teeth were sort of damaged, if we put crowns on, it would change the shape of his mouth, and he was worried that he wouldn't be able to sort of get his lips against, to blow and make the right sounds. So he said, at the moment, I need to earn as much as I can, because I want to retire in a couple of years. Once I've retired, then you do what we want. But that's
It did
very
actually happen
important.
to our trumpet player Jack Divers, that's been on the show before. He had some damage to his teeth, and he was really worried because to start with, he couldn't get the same notes as honest. He can now. He's managed to work it out, but yeah, it really affected him.
Yeah, it's one thing you've really got to consider with when a patient comes in and you say, "What do you do for a living?" or "Do you have any hobbies?" And if they say, "Oh yeah, I play musical instrument, or woodwind instrument, things like that," then you flag it up immediately because anything you do could affect that.
That's amazing.
Fascinating.
Some of the things that we've talked about over the past few months, Mark, have involved people who are reluctant to even make that first step into a dental surgery because of past experiences, because of their perceptions. And I wonder if maybe you could talk us through what a general checkup would involve, which hopefully for anyone listening who might be slightly nervous, might put their fears to rest. But Christy, you look a little nervous. Are you okay? You all right?
I thought I was going to get away with
With
this.
that. Shall we have a look?
Yeah. Let's have a look.
Let's have a look at Christy's.
Oh,
You chuck me some gloves.
Okay, so
Can I just stay sitting and
You
not...
can stay sitting, and I'll go behind you.
I'm going to make sure that I talk to you throughout
Oh
it. So
my
Kesha's
word.
got some instruments there. Oh my goodness. Are you okay? When did you
He's
last...
brought glasses
Brought
with
them
like
with you.
magnifying bits on and everything.
Oh
Well,
my
I didn't know what the light was going to be like, so I thought I'll bring a decent set of lights, and that way I can see what I'm doing.
Okay,
Oh gosh,
so...
here we go. So
Yeah.
have I got to sort of lean back or something?
No, you stay where you are, because otherwise
Okay.
you'll get a crick in your neck.
Wow, he's brought all kinds of
And,
things with him.
It's all going.
The magic glasses are
Why
going
is,
on.
Why is there a USB cable on your glasses? I don't understand.
So I can still pick up Manx radio, you see what I mean? Right?
Very good, I like
so-
it.
Now this is really bright.
You
Okay.
don't have a top
Oh, he's got a
pocket.
Don't have a
light.
top pocket.
Okay, so he's clipped the light onto his shirt. He's got his groovy glasses on.
So,
just about to put the
Kesha, you'd
gloves
normally
on.
be handing him all of this stuff, would you? And sort of like you'd be beside
It'd
him
all
and
be
just essentially,
we'd always set up before the patient comes into
Yeah.
the room.
You've got to have a really good relationship with your dental nurse, haven't you? So you sort of
yeah.
like understand each
Yeah.
other and
You'll spend. I don't know if you can hear me, but you'll spend more time kind of side by side with your nurse than you will with your wife. Because so if you have an argument with your nurse, it's worse than having an argument with your wife. You can
Yeah,
run
it
away.
can be very intense.
oh no,
in
now
the-
Ben's
the-
in as well. Oh
Right.
Ben, you're going to see something you'll never forget now.
Okay, so...
Okay.
So what we do, if you came in as a new patient,
What
that
do I
clip's
do?
a little bit loose there, so sorry about that, hang on. So what we'd do, we'd run through a medical history. I might just check under your chin and on your neck, just in case. If you sort of complained of any toothache, I'd want to see whether there was any glands that were swollen. So your glands there are all fine. So if you open up for me now. So I'm not even going to look at the teeth first, just relax a little bit and close your mouth. There we are. So the first thing we'll do is look around the gums and look around all the cheeks. And then if you open up a little bit, pop your tongue to the left, pop your tongue to the right, roll it up, and stick it right out. That's it, right out. Yeah, no, that's honestly, it's a proper thing. So that's just a quick oral cancer screen. So you would just check there to make sure there's no red patches, white patches, anything strange. You were just saying, go
Yeah, I was going to say that's just for checking for any abnormal lumps and bumps and yeah.
You're getting a really good view of my mouth, Beth. I'm really sorry about this.
That's all right. So now what I'd do now is I would give you a sort of plaque and a calculus score. So we might sort of say, right, plaque 1+.
Ooh, like a
one
competition.
plus.
Oh dear.
So, and if there's any staining on there, so that depends on. You see, you've got a little bit of staining at the back of your front teeth. So probably a big tea drinker, maybe a black coffee drinker.
I think it's the coffee.
Could be a bit of red wine
That's
in there.
my
I don't know.
diagnosis.
I'm hoping you're not a smoker. And then what I would now do is this is a little blunt probe. Okay, so I'd always
Okay.
just show you on the back of my glove there. That light drops off. Hang on.
Oh, putting your light back on your shirt. Okay.
It's only because I've got a top pocket. I'll tell you what, I'll leave that there. Right. So what we'd now do is we'd now gently go around your gums. So I'm not going to go all the way on this one, but we just probe just under the gum ever so slightly. And what this tells me is whether there's any gum disease or bone disease going on. So this probe, there's little graduations on this, and I don't want this to go any further than that first silver band. So the first silver band is 3 millimeters. So I'm just checking the gums to make sure, there's no bone disease. And I would go all the way around 6 surfaces on the tooth, and I'd give Kesha a score for each section of your mouth. She'd then write that down, and that way we can identify. We've got a basic screen to see whether there's any gum problems. So after we've done that, then we finally look at the teeth. So we'd start off on the top right, and I would chart, and for your mouth, you give me a bit wider for me, that's it. We'd say 8, 7, 6, 5, 4's missing, 3, 2, 1, 1, 2, 3, 4's missing again, 5, 6 I might want to get back and have a look at. 7's okay, and I think your 8's okay. And then on the lowers, big stretch again for me, that's it. So 8's missing, 7, 6, 5, 4, 3, 2, 1, 1, 2, 3, 4, 5, 6, 7, and the 8's missing. There you go. So, simple as that.
There we go.
So
He almost said pie. Did you notice?
I did notice that.
Trying to get it in.
That was completely easy, pain-free, quick. Yeah,
And not embarrassing at all on radio.
Ridiculously embarrassing.
It was not
Thank
embarrassing.
you.
That shouldn't be embarrassing for you because your mouth is not
I will
too
never
bad.
talk to you again if you put that video online, Ben.